I remember the first time I went for a meeting as PS Labor. It was still in the health sector. And since I'd been PS in health, and people were still referring to me as a PS Health, I told them, no, I am in labor. And they told me, do we bring an ambulance? I told them, not that labor. that I am I'm the PS labor, in labor, not PS. So from the onset, may I appreciate the invitation extended to me by the Kenya Medical Practitioners, Pharmacists, and Dentists Union to join you all during this important inaugural stakeholders roundtable on occupational safety and health for doctors. The importance of this in-depth engagement on occupational safety and health cannot be gainsaid. Hence, this discussion could not have come at a more appropriate time than this, as the sector grappled with unforeseen transitional challenges, including occupational hazards. As a State Department, we are keen to ensure that all workplaces meet government-set standards and guidelines on safety and health. Indeed, the State Department of Labor, from time to time, undertakes several measures ranging from formulation of regulatory frameworks, regular inspections and enforcements geared towards our vision of a healthy worker in a safe work environment. For operational purposes, the State Department has established Directorate of Occupational Safety and Health Services, we call it DOSH, that oversees the above-mentioned functions. The Directorate works closely with the Ministry of Health in promoting occupational safety and health, both at the national and county level. So far, we have carried out field services in not less than 29 counties, where we have the county occupational safety and health officers that form the field service division within DOSH. Other divisions within the Directorate include safety, occupational hygiene, occupational health, work injury, benefit administration, occupational safety and health institute, and lastly, administration training and information division. Ladies and gentlemen, it's worth noting that the State Department and the judiciary rely on medical reports done by doctors to take action on industrial or workplaces which fail to adhere to our guidelines and compensate workers as per the Work Injury Benefit Act. Given the integral role that doctors play in ensuring occupational and health for the Kenyan workforce, it's only proper that their health and well-being is taken care of. The State Department has not been blind to reports indicating an increase in needle stick and splash injuries, increased cases of workplace-acquired diseases such as tuberculosis and HIV, among others, increased work-related stress leading to substance abuse, and lately cases of suicides have emerged. These problems are further compounded by the lack of seamless induction system for newly recruited doctors and structured mentorship, debriefing and career support, complexities in decision-making, and lack of confidential and proper reporting channels in regard to injuries, high peer and societal expectations, and general stigma associated with seeking medical care amongst doctors. We believe no one is not convinced that an effective intervention is not only needed, but the intervention shall require concerted efforts from multiple stakeholders, notably the International Labour Organization, the World Health Organization, State Department for Health, county governments, Federation of Kenya Employers, and health development organizations and partners. We, as a State Department, in recognition of your various roles, urge you to collectively join efforts to promote and protect the holistic well-being of our doctors, especially at the workplaces. In this context, KMPDU has identified 4 key areas that are crucial in safeguarding the occupational safety and well-being of doctors. These are enhancing access to medical care, promotion of safer workplaces, encouraging self-preparedness and care by doctors, and development of mentorship and support networks. Ladies and gentlemen, this initial stakeholders roundtable is important in many fronts. First, it is the first time that the concerns and needs of doctors are being spearheaded by doctors themselves. We appreciate that the fact that they, doctors, have realized the importance of the presence of each one of us during this forum, but more so the appreciation that our partnerships and collaborations in the noble mission to address occupational safety and health for doctors. Looking at the pillars identified by KMPDU as being integral to the well-being of doctors, one cannot fail to notice that preventive measures in safety and health of doctors have been given primacy. It is therefore imperative that from this meeting we clearly identify some of the roles that each of us can play, taking into account our core organizational functions and mandates. Additionally, for us to achieve our objectives, it goes without saying that technical and financial resources will be required to actualize this initiative. The State Department of Labor is going to be an integral partner in this, and we will ensure that in line with our vision of a healthy worker in a safe work environment, doctors' well-being is prioritized. Ladies and gentlemen, as I conclude my remarks, I would like to express gratitude to all the union officials and the entire membership for this noble undertaking. I applaud the organizers for hosting this workshop and providing an environment where important workforce matters will be discussed with a view of arriving at shared vision on safety and health of our workers, and specifically for the doctors. As you are aware, our economies grow when our workforce is healthy and safe, and in this case, workforce benefits when the doctors are healthy and safe. As we all know, that when all systems, other systems fail, then all this land in the hospital, be it in engineering, be it in the society, be wherever, that when those systems fail, it becomes the doctor's problem. And then it's very critical that that doctor is well taken care of, because that seems to be the place of the last resort. So for this, then, I would like to take the pleasure to declare this meeting officially opened. Thank you all, and God bless you. Asante sana.